All right, welcome back to the Morning Blend. They say patience is a virtue, but when we want to get rid of wrinkles, who wants to wait?
No one.
Right? As we get older, our facial structure loses volume, and wrinkles just seem to come out of nowhere.
But Dr. Stacy Kaiser is here from a Younger You medical spa to demonstrate a treatment that works with immediate results. And she's brought along one of her patients to demonstrate. We've got Stacy Ward here as well.
Our brave soul.
Yes, she's already got her tribal markings on her face because these are our markings of where you're going to be injecting her in a little bit. You're going to be using Radiesse. What do people like about Radiesse?
Probably the best thing is it's immediate. You see it right away. I mean, boom, it's there.
What does it do? Because we mentioned that as we age, we lose volume in our face. What areas of the face, if you can use Stacy as our model, show us what areas, as we age, we tend to lose volume?
Sure. If you look out like in the lateral part of her face and these fat compartments, what happens is you lose face. As you lose volume, everything comes forward.
Okay.
So it creates a nasolabial marionette. Stacy's so young, I have to kind of exaggerate it on her so you can see them. But then if you get volume back in this area, it's going to pick everything back up.
So those aren't from smiling too much or whatnot. It's more from the dropping of your facial structure.
Yeah, probably a little bit of both.
But
to
so
correct.
stop smiling and
Right.
don't age.
So, don't age. This is a filler. How long does it last?
FDA approved 18 months.
Okay.
Cosmetically, whenever you want more. I'd say usually about 9 months for someone who's getting it for the first time.
And the results are immediate? I mean, you're going to do it here on the show. Will we notice a difference
You'll see
right
it
away?
right away. You'll see
Okay.
it right away.
And you're only going to do one side, so we get to see a half and half. And then that's all you get done, too. Just half your face.
Yeah.
That's it.
Exactly.
See who notices.
We asked her during the commercial break, we're like, you're going to finish the other half of her face, right? She said, yeah. So how many injections will she need to accomplish the goals that you just mentioned?
It'll be probably about 5 needle sticks, depending on, it's just visual, so depending on how it feels.
You've never done this before, correct?
I have not.
Okay, so this is brand new. So what you're seeing, look straight into the camera there. So just so we can see that this is the before, this is how you look. You have had nothing done, but you've got the markings on your face. And I would say go ahead, right?
And I wonder if people can see that on TV. This is the other side of her face. But you can see this white marking here. Stacy, Dr. Kaiser's not going to do this side of her face. She's going to do this side over here. Okay, go ahead. And the patient has a consultation too, I know, for this.
Can you talk while you do that, or should we talk?
We should talk, I think.
We'll talk. So as you're kind of watching it, I mean, you're obviously injecting in that circle area. This is the place that you said sort of pulls back and releases some of that nasolabial fold, one of the places that we lose a lot of that volume.
Yeah, and you have an open house, I know, coming up too this Thursday, so tomorrow night in the afternoon and evening from 3 until 7, people can actually ask questions and find out more about fillers and Botox and all the great different kinds of procedures and treatments that you do. And we're going to ask her when you're done if this is painful, because I think that's a very common question. Yeah, you're a good patient.
She's tough, no doubt about it.
Yeah, but I mean, I would think that's a very common question for patients to ask you. Is
there's not a lot of nerve endings in this area of the face, so it tends not to be too painful.
Okay, and it gets a little bit red.
Stacy can answer that better.
It was fine. Oh my gosh. No, my eyes aren't even watering.
Yeah, that's amazing. So is the area red for a little bit? Is there usually any downtime with this?
I've treated a lot of people over their lunch break, and they go back to work, and if they do get a bruise, they'll just cover it with makeup. But it is typical to be red, for an hour or so after.
Okay.
And how quickly will we see these results?
If you look right now, so if you look at this would be the malar separation, it's gone. So if you look on this side, and you can see where there's a slight break. If you look on this side, you can see where everything's pulled up.
Oh yeah.
That's amazing. Yeah, and sometimes there's just a little bit from the needle stick, there's just a little bit of blood, right?
Yes.
So that's something that's very common for people to see or experience.
Yeah.
And a little bit of the redness. And to think that will last for 18 months or maybe even longer, that's fantastic. Yeah. What kinds of questions do you get at the open house, like the one that you're having tomorrow afternoon and evening?
I think pain is a big one. I think a lot of people worry it won't look natural. And you can see, I mean, it looks so natural on her. Just that one side is slightly a little bit elevated. I think people
And the redness is already going down, too. It does.
And it gives her a youthful look without, I don't think anybody would say, hey, did you get some filler?
No.
It looks really good.
It does. That's
Look at it, nice
amazing.
and close up. It looks really good.
Yeah,
Yeah.
I think it looks good too.
That's
I think
impressive. Let's look at some before and after pictures that also demonstrate the results of something like this. I mean, that's extraordinary right there. The picture on the left, of course, is the before. What did she have done?
Same product, Radiesse. We did a little bit up, like in her temporal area and cheeks, and same product.
Oh, look at the softness there around the mouth too. You can really see how that happened.
Yeah, those are those folds there around the nose that you can see. I mean, I would say that patient looks from the left to the right at least 5 to 10 years younger, and the same there. It just plumps
Is that all
it just
from
a
the
little
cheek
bit.
area, or is that also using a filler in that area?
Both.
Okay,
both.
a little
lot
bit
of
of
the
both.
pictures. Stacy doesn't need it, but a lot of times you add a little bit into the nasolabial.
Yep.
You'll first correct the volume in the cheek, and then.
It's wonderful.
Yep.
You look
All right.
great. You were a great patient.
Yeah, you're
She
a really
didn't
great
even
patient.
flinch, like
Just
you
give
said.
her one side though. Don't
We got to
finish it.
balance her out. Here's the open house that's going on tomorrow. Again, as we mentioned, it's in Brookfield from 3 until 7 p.m. That's tomorrow afternoon and evening. You can stop by, ask questions, and if you mention the morning blend, you will get, and this is the special offer, 50 units of Dysport for free with the purchase of a syringe of filler. And what does the Dysport do? Is that a filler also?
It's a muscle relaxer.
So
it
instead of like a
helps with-
Botox, right?
Yeah, mostly forehead, crow's feet, it'll relax.
Well,
wrinkles
I bet
and
that works great in conjunction with the filler. So you
Yes.
get the Dysport, which is like a Botox. People are very familiar with that name, but you
Yeah.
get the Dysport with the filler, which is a great way to erase even more of those wrinkles. And you can call a younger you. We have 2 phone numbers. One in Burlington, it's 262-783, or 763 rather, I'm sorry, 5573. Or you can call Brookfield 262-661-9166, or visit them online at ayoungeryou21.com. Thanks, ladies.
Thank you.
Live demo. I like
Yeah.
that.